Hi, I'm Dr. T. Skrozian. Did you know that brain fog followed by fatigue and depression are the earliest signs of neurodegeneration and the clinical signs that your patient may have neuroinflammation? And these are things to not be taken lightly. One of the things that we know is that throughout the life, many things can turn on glial cells and prime them. Uncontrolled blood sugar levels, oxidative stress, systemic inflammatory issues, gut inflammation. There's a whole host of things that then turn on these glial cells in the brain. The interesting thing is when these glial cells turn on, they don't easily turn off. And then these inflammatory states exist in the brain for many, many years. And eventually these cells start to actually lose their ability to clear off protein aggregates like tau proteins and tangles involved with Alzheimer's disease, or alpha-synuclein and Lewy bodies involved with dementia and Parkinsonism and so forth. So the next time you hear a patient come in to your office and tell you that they're depressed and they can't focus, they can't concentrate, and they're really fatigued, especially fatigued when they try to use their brain like reading or driving, you really should know that their brain is inflamed. And if their brain is inflamed, you would have a really, really hard time turning them around clinically unless you can specifically get their brain inflammation down. And when you look at brain inflammation, you have to look at all the pathways that activate the brain. So we know that even if the blood-brain barrier is intact, there are 4 distinct pathways that turn on brain inflammation. Furthermore, we could have the blood-brain barrier break, and that can cause inflammatory responses. So there's a list of metabolic and immunological factors that can lead to brain inflammation. It's very important for you as a clinician to know how to identify brain inflammation and then dissect each of these mechanisms in your clinical practice. In my neuroinflammatory course, I will give you a step-by-step approach, not only how to identify neuroinflammation in your office, but what to do about it. The information I'm going to share with you is very detailed and very clinical applicable to whatever you do in your practice. I think you will gain a lot learning this information, and you will be able to turn around some of these chronic patients that may not be able to be helped unless someone knows exactly how to bring down their neuroinflammatory cascade in the brain. Hope to have you join us, and thank you for your attention.